Hello, and we are started again in the urinary system. So, to start us off with this unit, I know we drew it last time, but today, what I would like for you to do is create a urinary system with household objects. So, you'll see when mine pops up, which it will, you'll see that I had Starburst around. So, I made kidneys out of Starburst, and then I took spaghetti. So I took spaghetti and made ureters, and then I took another like yellow Starburst for the bladder, and then I put another little length of hose, if you will, with another little spaghetti for the urethra. In the model, you'll see a couple of things added from our last time because the drawing that we did was pretty precursory and starting out. So you can see that the kidneys kind of have hats on, okay? And those kidney hats are the adrenal glands. We'll learn about them in the next system with the endocrine system. But they sit right on top of the kidneys, and they control things like our fight or flight reaction. So, urinary system. I'm going to stick here for just a second because on your sheet you have some terms that I wanted you to go over. And I'm just going to quickly go through what those terms mean. And if you miss it, rewind. Now okay, so benign tumor was number 1 on your sheet. A benign tumor is basically when you have cells that are kind of growing a little bit out of control, but when they test it, so they'll actually take a sample of the tissue and they'll see if it's cancerous. And a benign tumor is basically like a non-cancerous tumor. So the only place where that would come into, where you'd come into problems with that is if it starts to press on something that's a vital function. Like if you press on a blood vessel and you're having a hard time delivering blood flow distal to where that artery is being compressed. Or if you compress a nerve, something like that. But a benign tumor, that's always, if you're going to have a tumor, that's good news. Okay, second one is metastasis, and that's basically the spread of cancer cells. So if you had, let's say that you had cancer starting in your bladder, which could happen if we start to see that happening in lymph nodes, or if it traveled to other areas, then we would say, the cancer is metastasizing. So metastasis, the spread of cancer, it grows away from the original site of where the cells started to grow. Okay, the third one is, I want to make sure I give it to you in order. Benign tumor, metastasis, filtration. So basically filtration is anytime you're trying to separate like solid things from liquid things. So that's what your kidneys do. They do a lot of filtering. Okay. And then the fourth one is lithotripsy. I always say so. I've always botched it, but it's basically litho means stone. Tripsy is kind of the sound waves. You're gonna end up with sound waves that are blasting kidney stones. Essentially, that's what it's a procedure that is often used for kidney stones. Next is dysuria, which just means painful or difficult urination. And then the last one is dialysis. So worst case scenario with kidneys, if they stop filtering the blood, if they stop doing their job, then we have to use a machine that does it outside the body. That's what dialysis is. So maintenance systems, where we're in strand 5. These are standards 4 through 6. So, okay, here are the functions of the urinary system. So let's say that you had some kind of a water challenge with a friend where you're like, let's both drink a gallon of water today. I've done that before. I do it with my son-in-law all the time because he's into fitness, and so we're always doing these stupid challenges with each other. So basically, if you take in more water than you're used to, you'll notice that you will urinate a lot more frequently. And the reason why is because your kidneys are getting extra fluid and they're like, okay, we got a lot here. Let's go ahead and filter out what we need, and let's go ahead and get rid of the rest. So if you drink that much water, let's say you drink a gallon, which you should never drink a gallon at once. They've had people die from that. But if you say drink a gallon over the course of a day, you'll notice a lot more urination. And that's because your kidneys are working to regulate the volume and the composition of blood. They don't want it to get too diluted. And we also don't want it to be too syrupy and thick, if you will. So that's basically the kidneys kind of trying to regulate. And also the kidney will produce urine so we can get rid of the excess waste. Okay, so you should have a sheet that looks exactly like this. The picture will look like this. And kind of an add-on in this one, you're seeing the same things. We got 2 kidneys, we got 2 ureters, we've got a bladder, but one thing that's missing that should be like next is a sphincter. So right at the base of the bladder, there'll be a little muscle that's essentially anytime you have a sphincter, it's going to be like a circular muscle that closes off like this, kind of. There we go. Closes off like this. So the sphincter is there to just hold the urine in until you can't anymore. And then you get to the urethra, and the urethra is just where the urine exits the body. Okay, kind of wanted to give you in the curriculum. It says, well, the kidneys are located in the right and left upper quadrants. So if you take the body, so I can kind of stand up like your abdomen. Whoopsie, abdomen is broken up into 4 quadrants, and they break it up even further than that. I'll show you in a second. But the 4 quadrants. So up in the right upper quadrant. So the way I'm looking, I'm like up here. Okay, or I'll move the mouse so you can kind of see. Right upper quadrant, you can see there's the right kidney in that right upper quadrant. The left one it's behind there. You can't really see it, but it's behind there in the left upper quadrant. So they sometimes will break the body into 4 little spaces to kind of go like, where's this organ? Where are you feeling pain? Stuff like that. Or they'll do this. Wow. So in my forensics class, we've seen this. Mainly because when we do an autopsy, we need to be able to pinpoint exactly where the injury is. So this gives us a little bit more specific abdominal area regions. So just so you can kind of see some of the things we've seen before in the epigastric, which is in that middle upper one, like tic-tac-toe square. There's your esophagus. We saw that last unit. Your right and left kidneys fall in there along with the left and right hypochondriac, it should say. I don't know why this, whoa, I'm going back. I don't know why it's saying hypochondriac, and the one on the left is accurate. The one on the right is misspelled. Sorry about that. I should have caught it before I threw that in. Okay, kidneys. So just so we get a little more in depth on each of these organs, because remember, you get an organization of life. The basic unit is cells. Group of cells together is a tissue. Group of tissues together, that's an organ. And a group of organs together is an organ system. A group of organ systems together, that's us. We're humans. So here we have kidneys with the little kidney hats right there, the adrenals. They filter the blood and produce urine. So bada boom, bada bang. And then we get to the ureters. These are the tubes that connect the kidney with the bladder, and they're going to transport urine from the kidney to the bladder. So you can imagine there might be, if you ever have a blockage in the ureter, that could be pretty painful and cause some backflow and things like that. We'll talk about that when we talk about kidney stones in a minute. Then we get to kind of the end stop for a brief period, and it's just waiting until it's time to let that thing go. If you look at this particular bladder, you can actually tell if this is male or female just by looking at that organ that sits right underneath the bladder. So what you're kind of seeing, I'm going to roll my mouse over it. This is like pelvic floor muscles right here. This is the urethra. And then this purple kind of circular thing, well, what is that? We haven't learned it yet. It's in the reproductive system. This is the prostate gland. So this one would actually be a male bladder. Okay, so there's a urinary bladder. It's a sac-like structure found in the pelvic cavity, and it stores urine. That's it. Okay, so just kind of a couple of differences. Well, really, one major difference between males and females. If you look at where the bladder is, here's the bladder in females. So we got a sagittal view of both. Here's the bladder in the males. There's that's the prostate gland I was showing you in the last one. You can see the urethra in girls is pretty short, about 2 inches. And the male urethra actually extends from the bladder all the way through the penis. So that would be a longer urethra in the males. And the whole point of the urethra is to transport the urine from the bladder to the outside of the body, just to get rid of the urine. Okay, so diseases and disorders. We're just going to get right after it. First are kidney stones. So this is one that it can be something like if you know your family has kidney stones, you may want to start to pay attention to what their habits are. My dad and brother have had these. And when I was having issues last month, we kind of thought maybe kidney stones just because it runs in the family a little bit. And a lot of times it can be from eating or drinking excess minerals. So you can see like calcium's here. So, and I don't want to exclude particular foods necessarily, but just know that when they actually kind of pull out those stones and they analyze what's in them, calcium, oxalate, and uric acid are typically what's found inside those kidney stones. So things like drinking too much soda is something that I've seen. Sometimes drinking too much or having too much lactose can cause some problems. Signs and symptoms for this, there are a lot of them. It's painful, and there's pain with urination. There could be blood in the urine. There's a lot of other symptoms there. So just kind of think of very uncomfortable, painful. And if you're thinking of like the ureters, so if we go back to the ureter real quick, or even this picture, if you look, here's the ureter. The stones form in the kidney, and sometimes those stones are like star-shaped, and they're like, picture a rock that's like this. And you're like, okay, it comes out of the kidney and then starts to travel through the tube. And it really can be like with these little rock arms jutting out, and it's going to be rubbing against the smooth muscle in the ureters, and it's just not comfy, you know. Okay, so those are signs and symptoms, and here's what we do in medicine for treating it. So you could take meds. So that will just be for pain. It's going to be one of those opioids, essentially, that they feel good, but they're very addictive. Lithotripsy is what a lot of times will happen. And I'm going to show you a quick picture of that. We'll come back to this. The bottom picture is what lithotripsy is. It's essentially sending shock waves or sound waves to break up those stones, so that hopefully you can just urinate them out, make them easier to pass. But sometimes they have to go a step further. So they'll do a tunnel surgery or a ureteroscopy, and that's what you're looking at, your ureteroscopy. Ureteroscopy, that's a good word. That's, if you look at what they're doing right there, they're actually going in through the urethra. And it's all connected. We're all a series of tubes. So it's going to go in through the urethra, through the bladder, up the ureters to the kidney. And then a lot of times with this one, they're going to go ahead and do the balloon, kind of blast that little stone. And sometimes they just will do it that way. So that's kidney stones. In the worst of scenarios, you can have some problems with your kidneys filtering. So your kidney can just fail. And if it's not eliminating the waste or the excess fluid that your body has, you can imagine it would be pretty terrible. So when the kidneys lose their filtering ability, we're going to end up with a lot of fluid and waste accumulation in the body. And the signs and symptoms will include these. So decreased urine output. They'll appear sort of puffy because of fluid retention, drowsy, shortness of breath, fatigue, confusion, seizures, or coma in the worst cases. And then treatment includes, in a lot of cases, a modified diet, we've got to control for some of the micronutrients there. IV fluids, trying to push stuff out. Dialysis until kidney function returns to normal. So dialysis is when you have to be hooked up to a machine in order to filter the blood. So this happened to, I always have a story, right? This happened to my best friend's dad. He actually died after sustaining a really high C-spine injury. So he had a spinal cord injury that left him as he was quadriplegic, so couldn't use his arms or legs. Pretty miserable existence after he had been a super active 6'5" athletic dude his whole life, and he endoed on a snowmobile and hit a tree and ended up breaking his neck. And a lot of times people will think, well, he maybe died from that, but what happens is a pretty high spinal cord injury. Sometimes the signal from the brain to the kidneys is interrupted to say, like, filter the blood, filter the blood, filter the blood. That's what you do. And since it's interrupted, a lot of times if you get a really high C-spine injury, you could be interrupting vital organ function. So there are other reasons that would happen, obviously, and I went into like the most extreme one, but that's the one I know. So there's an old-fashioned UTI, or urinary tract infection. So it's basically like cystitis is a way of saying inflammation of the bladder. And it's typically caused by bacteria. So if you kind of think about the way the anatomy sits, it's more common in women. And I'm going to go back. I hope this doesn't make you uncomfortable. We are going to be going into reproduction pretty soon. But when you go back to the male and female anatomy, if you can see, here's the urethra. Here is the digestive system where we ended in the last unit. And there's a little bit of a block there. So really the chance for bacteria to travel to the urethra from the digestive system is not as likely here, but it is more likely in this case where you have, here's the rectum, anus here, and then the urethra is here with no block, if you will. So that's why it's more common in women. So back to this slide. Signs and symptoms of a urinary tract infection include urgency, which means you just feel like you have to go right now. Frequency, burning upon your urination. Dysuria is painful or uncomfortable urination. And then sometimes there's a discharge that could be like pus or something like that. And it is treated with, in the case of bacterial infection, which is the vast majority, antibiotics. So urinary tract infection. Okay, there are some careers that are associated with this system. So a urologist is one that would be looking at the urinary system, but also a urologist, urologists will typically care for some of the sometimes some of the male reproductive anatomy. So if like Pops is done having kids, he can go have a vasectomy, and a urologist a lot of times will perform that surgery. Dialysis technician is someone that's going to run the machine for those people that lost the kidney function. And then you have these are kind of lower end jobs. If you have a medical lab technician, they're a lot of times not necessarily diagnosing, but they are analyzing labs. It could be analyzing, it'll be like a urinalysis, something like that. Medical assistant can really exist throughout medicine. It's kind of a low level, I don't want to say secretary, but a lot of times it'll secretarial work, or they'll be the person that in our clinic, our medical assistant was, they're not paid very good, but they'll take the patient back, get a good blood pressure and heart rate, and just start to get some of the information, kind of like a nurse does in some situations. So it kind of depends on the clinic where they work, what a medical assistant's role will be. But it can be clerical work to you just rooming the patient and getting them ready for the doctor to come, stuff like that. So that is it. That is the urinary system. It's short and sweet little guy. Today, if you will complete the notes that we have and also put together some kind of a model of the urinary system that includes everything that was in mine. The only thing I don't really care about seeing, I did put marshmallows as hats on my starburst for my kidneys, marshmallows, but I don't necessarily need to see the adrenals for this. I just want you to know where they are at, because we're going to move into that system next. So I will see you next time.